So whenever something at the bottom of the spine is happening, it's going to have a reverberation all the way up the spine to the neck, and hold. Okay, so both sides, that's what we call the ballet test, and it tests to see if your iliac, the hip, is happy opening or not. The T12, yeah, a little bit tight there. Just going to have a little feel of the neck, sorry. So what I'm trying to do here is ease off the vertebra that might be restricted because of tense muscle and spasm. I'd like to do some cupping around this area.
In the sauce, which brings the flavour out.
Okay, first one going here. So I'm going to work on the pelvis from the leg, just checking out the foot first for all the reflex points for neck, spine, pelvis, hip. Feeling what the spine is doing and the cerebral spinal fluid. Nice, smooth movement, no pain. I bet you'd fancy some hot socks at the moment, wouldn't you?
Ooh.
Good bounce. And then have a feel of the top of the spine. Yeah, there's some tightness there. Let it go, loose, loose. That's it, beautiful. Good. And hold. Absolutely so different. This is the one that was both sides really soft earlier. Sciatica.
Well, it's not so much down my legs today, but it's all in here.
Yeah. So, Rosie, can you raise an arm for me into the air? I'm going to push down. You're going to resist me pushing. Stop me pushing and hold. Lovely. Same the other side and hold. Okay. Can you raise a leg for me? Hands off your hips and lower your leg, Lovely. So I'm going to push here. You're going to hold up. Stop me pushing and hold. Lovely, good. Same this side and hold. Okay, can you do two together and hold? Nice, and hold. Okay, so I don't know if you noticed that, but arm and leg individually and together this side, nice and strong. You can support it. It's not an effort for you at all. This side individually and together, there was a weakness.
Okay.
Did you notice that?
I did slightly,
Yeah. So I know your pain, did you say it was on this side?
Yeah.
So quite often it can be referred.
All right.
So it can, the source of
It
it.
has been dodging about a bit the last 2 weeks, I have to say.
Arm and leg again and hold. There you go. So no effort for you. You find that really easy.
Yeah.
Whereas the first time it was a struggle to keep them up and they bounced.
Okay.
So I think you've got a sacroiliac separation on your left-hand side.
Yeah.
I think it's about medium placement, so about here, as opposed to lower or upper of the sacrum. And it's very common. I mean, it shouldn't be there, but it is very common.
I've been doing a lot of driving lately.
Have you? Okay, maybe it's your driving position.
Possibly. I'm always like that.
The most important thing, which I notice in clinic that causes sacroiliac separations, is not being symmetrical. So being twisted or doing something more actively one side of your body than the other.
And also I've been fishing again.
Oh, okay. Yeah, lovely. So that may be something you're doing not symmetrical.
You know, it's all one side.
Right.
Like that.
Okay.
Am I right?
Yeah.
So that could be...
So what happens then is it twists the pelvis.
Yeah.
Okay. And we know in core therapy that the pelvis is absolutely connected and related to the neck. So
Right.
whenever something at the bottom of the spine is happening, it's going to have a reverberation all the way up the spine to the neck. So the neck will be affected as well. Quite often it can actually come from the neck and cause the pelvis. So it's chicken and egg, what came first.
Yeah.
But I will be
Okay.
treating both.
Okay, good. Eh?
Okay?
Yeah.
So I'm just going to do a bit more pelvic testing. Can you place your sole towards your knee by bending this knee out, resting it on the couch, and then relaxing that knee out as much as it will go? Meanwhile, can you raise this leg off the couch? Yeah. I'm going to push here, you're going to hold up and hold. Okay, so a good bounce there, which it shouldn't do. It should be nice and strong. And now repeat the other side.
Of course, my knee goes out of joint then when I do that.
Okay. A hand off your hip, lovely. I'm going to push here and hold. Okay, so both sides, that's what we call the ballet test. And it tests to see if your iliac, the hip, is happy opening or
Yeah.
not, each
Yeah.
one. Both not happy. So we'll test it again at the end once
Okay.
we've done a few techniques and
Yeah.
see if it's better. It should be, quite often it is, so we'll see.
Quite an interesting thing with my hips. I started doing Pilates. I don't know whether it was last year or the year before. I think it was last year. And down at Village Hall, she's very good. But within a few weeks, I was in agony with my hips.
Oh.
I stopped, and my hips were fine again.
Oh,
And I'm, one of these people. I do not want to have hips done.
no.
And
None of us do. Right, I'm just going to have a look at your posture. Okay, so this hip is dropped. Yeah, not too bad actually. I am being picky. And can you raise this arm on its own for me and hold? Lovely. And again, and hold. Oh, okay. Right, so definitely it's into the right ASIS and hold. Good, okay. And the other way and hold. No, I could tell as soon before I even touched you. So it's that way. So there is a twist that way and it's this hip here. I'm just going to see if the pelvic girdle is intact and hold. No. Okay. So can you put two fingers from this hand on your pubis symphysis, which is that hard bone, dead centre of your pelvis, right in the centre,
Right.
low down, yeah. And then arm up again and hold. No. Okay, so we're just going to have a look in a bit more detail. I'm going to use your fingers. If you can push there towards here, so you're pushing that way, arm up again and hold. Lovely, okay. And then pulling and hold. Okay, that was better. And then over here and pushing towards my hand here and hold. Okay, and then pull the fingers up that way. Lovely. And hold. Okay, so there's a mixture there. I'll just do my notes. Okay, I want to have a little look at the neck. So, can I take your leg out towards me, raising up into the air? I'm going to try pushing down if you hold up for me and hold. Lovely, good. That's great, really good. Out to the side, up into the air. I'm going to try pushing down to the floor and hold. Okay, just a little bit. So, that was your psoas. Right hand side, I'm just going to check the T12. Yeah, a little bit tight there. Just going to have a little feel of the neck. Sorry. Okay, so C6. Yeah, sorry, that's the one. So they're related to each other when they go like that. And leg comes out, up into the arm. I'm going to push down and hold. Oh no, still some weakness there. Just going to have a little feel up and down your spine. Yeah, that one I could feel it was protruding. So it's a bit higher up. It's about there, isn't it? Sorry.
Yeah, there and a bit low.
This of
And
here.
then on that, on
Here.
Yeah, that's it.
It's just under it. Okay. Up, out again, and up, and hold.
That's my hip.
And hold. Oh, sorry.
It's all right. No, do it. It's extraordinary.
Yeah. So that's your psoas. That definitely needs... I did wonder whether your neck would be involved.
My neck usually is. And I do have a long neck. And I've always had that sort of humpy bit there, which you noticed particularly last time. I'm thinking as I'm getting older, I'm just cracking up.
Some people have a humpy bit, as you call it, that is more bony, and there you can feel it's the T1, the thoracic one, that sticks out. But with a lot of people, I see it now, especially youngsters, that bony bit is actually becoming more fleshy, and there's like a fleshy, quite malleable lump there. Sometimes it can go quite hard and firm as well, and that's normally it's a text neck. So it's at the bottom of the neck, at the top of the back, really, here. And it can form quite a mass. But that's because the body is trying to support a very heavy head leaning forward. So the advice is what we should do with our phones, instead of like this, which we all do, put your elbow into your rib and hold your phone more in front of your eyes. It's this difference.
I've had this for a long time, though. It's been sort of...
Even before phones.
Oh, no, I don't know about that, you see. That's the thing. I think it's happened from late middle age to where I am now.
Okay, so it might be part of it, but everything we do, we've just got to think about stacking our head on our spine, not leaning it forward for whatever we're doing.
Yeah, I know when I'm walking, I'm always thinking...
Okay, what else do I want to look at with you? I think you can turn over, Rosie. Okay, so a couple more tests. Can you bend this knee and raise it up into the air? I'm going to push here, so just bend it, and raise, that's it, and hold. Okay, finding that tricky.
That's quite an ask anyway.
Yeah.
And this one?
Yeah, and hold. Okay, so the reason that's tricky for you is because of your neck again. So I'm just going to have a little look at C2, cervical 2 in the neck, and I'm having a feeling that that's probably going to be a bit sore there.
It is, absolutely.
Yeah. Yeah. Okay, so if that was fine, you'd be able to do that exercise quite easily. Can you now put your little finger to your thumb, hold them together?
Both sides?
Just this side. I'm going to try and pull apart. You're going to hold together firm and hold. Nice. So now I'm going to keep coming back to that after testing your sacrum. And again, and hold. Okay, that's all right. And again, and hold. Okay. And hold. Good. And hold. Yeah, okay. So it's the south and east, as I call it. So the bottom and right side of the sacrum is compromised. So there's obviously a little bit of tipping there going on. I'm not surprised because of the pain you're getting. So your pain is on this side, isn't it?
Yeah. It's not so much down my leg today, but there's a lump there. And that lump is where there. That's where it's sort of... Oh.
Yeah.
Ooh.
So it's like a spasm of the muscle around the sciatic nerve. Yeah. But it will be caused from here. This is where the sciatic nerve in the spine starts.
But it's not where my operation was, is it?
Same as my op, wasn't it? We've talked about this before. It's probably, similar. It's probably a little bit lower than that, but very similar place, yeah. So, we have to look after our backs, don't we?
I know. Where did you have your op done?
Same as you. I think we've talked about it before. Mine was S5L1
Yeah.
in between, which is the very last disc. And the disc was protruding, so I had to have the disc shaved, but also the bones around it were shedding fragments. So, so there was a fragment swimming around, causing me intense pain, which did produce sciatic pain. I couldn't walk.
No, I was exactly the same. Why did you have it operated?
Not round here. I didn't live round here at the time. It was Wellingborough Way, near Northampton.
Yeah.
And it was great. It was a miracle.
Yeah.
You know, I was in a wheelchair beforehand.
Oh.
Yeah, I couldn't walk. I couldn't drive because it was my driving leg.
Yeah.
So I couldn't use the accelerator. So couldn't walk or drive. It was awful. Obviously, I had to stop work. And it came out of the blue. I only had the pain for about 3 or 4 months, and it absolutely intensified.
Yeah.
And then I got it sorted, and it was a miracle. And I was only young. I was in my early 40s.
Yeah. Yeah. But that's when I started getting trouble like that. And twice the disc sort of went back to normal, and I got over it.
Yeah.
But then I was mid-50s when I had to have the op.
Right.
And it just, as you say, so intense.
Oh, yeah. It felt like someone was holding a cigarette against the side of my calf.
Oh, right down there.
Yeah, mine went quite low, yeah.
And did your foot go cold?
I can't remember that. Oh, maybe. Yeah, so we want to avoid going into that area again. We don't want anything like that, do we?
No.
Yeah.
Oh.
So I get regular core therapy every few weeks because I don't want to go back to anything like that kind of pain again. And if I'd have known core therapy when I had that pain, I don't think I'd have had it. No. Because core just keeps you aligned and well and prevents all of these twisting that happens in the spine and the neck, etc. Yeah, all the spasms. Is this feeling okay?
It hurts.
Where does it hurt?
Where you are.
Yes, it's quite tight here, isn't it?
Yeah.
Do you want?
I'm always tight there.
Yeah. Do you want me to be a bit easier on you?
No, carry on. But I had a horrid thing on Saturday, which hasn't helped. My car blew up with me.
Oh dear.
And that's sore in there. Ooh.
Yeah.
God, yeah. The turbo blew. Did what it did, and it frightened me to death because there's black smoke like you have never seen coming out of my car, and I was still in it.
Were you driving?
Yeah. And anyway, eventually I had to stop. I thought I'm going to get as near to home as I can, and I got as far as the lane down there, you know, to Nutmuddy or whatever it's called.
Yeah.
And I stopped and got out, and I couldn't believe it.
Oh my
Anyway,
goodness.
so I haven't got a car at the moment, so it's Jeremy's car. I got it.
Oh dear.
Yeah, no.
Poor you.
Well, it did frighten me, I have to say. Just because I didn't know it was going to burst into flames, you know.
Oh. So what's happened to the car?
Well, it's gone into Cheltenham Land Rover, and it's going to cost an absolute fortune.
Oh no. And why did it happen?
No idea, because the car wasn't. It's done 58,000 and it's 5 years old. It's not as if it's, you know, overly old or anything.
Yeah.
I don't know. I just don't think these cars last anymore. They seem to. So I don't know what to do about it. I've got to hire a car this week, which is a bore.
Oh dear. So what I'm trying to do here is ease off the vertebra that might be restricted because of tense muscle and spasm. Okay. There might be some what we call subluxations, which means individual or even two together vertebra moving out of its normal line of alignment, so it might be shifting left or right, and it's staying there, but I'm getting it to move back in line with the spine. Or you could have fixations where 2, 3 or more vertebrae could be moving as one rather than individually.
Right.
And obviously, once vertebra can move individually and not protruding left or right, then you get more mobility, range of movement, less pain. The spine moves freely and fluidly, and therefore the neck will and the pelvis will. So I'm now working on all the muscles around the spine as well, checking out if there's any particularly cool, cold muscles or particularly hot, inflamed muscles. Seeing if there's any spasm or inconsistency left to right. Bouncing the scapula. Picking up the trapezius. Have you not had a treatment for a long time? No.
I have been, I've now got 4 little grandchildren.
Oh, congratulations, Rosie.
Yeah, but it's all happened in the last, and my life was busy before I had those, and now, I just, well.
Are you helping a lot? Are you
Yes,
like?
I do.
Do you have them on a regular basis then?
Not so much. I don't. We started off thinking maybe a day a week would be good. It just didn't work for any of us. And so now, like this morning, Sam said, "Mommy, would you like to have B tomorrow night?" So tomorrow night, I've got B. She's the oldest one. She was the one that was born 3 months too early.
Yeah.
She's a right little monkey. And then the youngest one is little Millie, who is, well, not so little Millie. She's, 6 months now.
Oh.
Yeah. So I'm always off down either to them or to Poppy, and I'm always on my way somewhere. And I have to say there's a fair amount of lifting and stuff.
Yes. Yeah, so lovely news to tell you, and I haven't told the viewers yet actually, but my daughter is pregnant.
Oh, wonderful. So you're going to be a granny too.
I am, in September.
Oh, lovely.
Yeah.
It's a nice time to have a baby in September because it's usually quite warm.
Yeah.
Oh, lovely.
Yeah. So very excited.
Yeah. Gosh, where does she live?
Not far away, only half an hour.
Oh, that's good.
Yeah.
That's great.
So we're just going to do some glute max releases. Can you bend this knee for me, Rosie? I'm just going to do a placement here, and then can you slowly lower your foot back down to the couch? How horrible was that?
It was horrible, but it wasn't horrible.
Okay. Can you bend it again? Is that too much?
That's quite strong.
Yes. Well done. So what we're doing here, you've got very tight muscles, and this will be shifting the pelvis. It'll also be affecting the neck. And so what I'm doing is I'm holding one end of the muscle, meanwhile you're lengthening it down by putting your foot down to the couch. And so between us we're stretching that elastic band, because at the moment it's in spasm. So this will really help you. I'm going to do a few more, but do tell me if it's too much for you, won't you? Okay, so bending the knee again. You okay?
Yep.
And again. Well done. That was a good one. I could feel it releasing. And again. You're doing really well, really well. Of course, that's the side of the pain. We're just going to, interestingly, do it this side as well now. And for you and me, it'll give it a bit of perspective. Can you bend the other one? That's good. And again. And again. Too much, okay. Okay, I'll just give it a bit of easing off. So what I intend to do with you, Rosie, if it's okay with you, is I'd like to do some cupping around this area, where the pain is, on each side of the sacrum and slightly into the glutes. Would that be okay with you? So can you remove your top and just undo your waistband for me? Do you still go round the hill, or do you walk to Wormington? Or?
Yes, I do all that.
Yeah.
I very often find I go up the top of the hill and along and back down the way I came, because actually it's equidistant.
Yes.
And it's not quite so muddy in when it is wet.
Yes. Mind you, the bluebells will be coming out soon, won't they?
They certainly will. And we've already had loads of wild garlic up there.
Yes. Do you pick it?
Yeah, I do. It's delicious, so good.
Yeah. Do you have it raw or cooked?
What I tend to do is to put it, I know you don't eat fish, but if I make a sort of sauce with fish or anything, I just chop it into it, just give it a minute, sort of in the sauce, which brings the flavour out.
Okay, first one going here. They feel okay? Hopefully nice and warm. I've got the heated bed on, is that all right?
Yes, I can rarely have too much heat, I'm always cold.
Yeah. You feel warm to me.
Do I?
Yeah. I think when I was doing my kinesiology tests with you earlier, my hand was much colder than yours. So, having introduced the cups with a little flash cupping, I'm now going to bring the cups all the way down each side of the spine. Nice long straight lines, bringing that warmth from the heart area down thoracics to lumbar. And this will ease any spasms in the muscles, mainly the erector spinae and latissimus dorsi. And up here we've got the trapezius that may be shifting the vertebra over left or right. They just need to be left to be aligned and in the correct position. There's some tension here around the shoulders. I'm just trying to relieve. I can feel that tightness here. When I was doing the tuina, it was on the bra line here that was most tender. Bring some heat there. Producing another cup. Nice and warm. Leaving it on about T2. There we go. The funny feeling, isn't it? Feeling all the skin draw in.
Yeah.
And of course all the fascia underneath. Underneath those layers of skin. Also drawing up into the cup, creating that warmth and anti-inflammatory action. That feel all right if I'm coming out? Yeah. Right, and now on this area that can be causing sciatic pain, removing spasm, easing, deeply massaging into those lovely muscles, and on the sacrum.
Did you look up what the nard was?
Not yet, no.
No, I haven't done it.
Yeah, because I didn't want to talk too much in church with, when it's all going on. But Jez and I have watched a series called The Chosen,
Yeah.
which is absolutely amazing. You'd have to Google it to find how you can watch it. I'm not sure if it's on Netflix or whatever. But it's the story of Jesus from birth onwards. It's so beautifully acted, and it's done very respectfully, and in Jesus' time it's not like a modern rendition. And you really get to learn about the story of the Bible and his life, and what an amazing man he was.
Yeah.
And so the part of his feet being washed by Mary was portrayed. It's been on recently, that episode, because they haven't finished posting it all yet. But that particular one was done recently. And it's such a lovely rendition. It wasn't actually Mary who treated his feet in this series. It was Lazarus's sister.
Okay.
And the love she has for Jesus and the intention when she goes to buy the oil, and what she wants to do with it, and then coming back and treating his feet, is just so beautifully done. It's enough to bring you to tears.
Really?
Yeah. And there are lots of scenes in the whole. There are, I don't know, there's something like 5 episodes with 10 in each or something. So there's a lot to watch.
Yeah.
And there's quite a few scenes that you're brought to tears by how an amazing a man he is.
Yeah.
Yeah. It's beautiful. The Chosen.
Yeah, okay, I'll have a look.
How's it all feeling, Rosie?
Hard to tell till I'm sort of up and about.
Yeah. But the actual cupping's feeling okay.
Yeah, no, it's fine.
Yeah. So I'm just going to lower this a bit more. I want to do a little bit more into the hips and top of the glutes. Is that all right to there? Thank you. That feel okay?
Yeah.
You notice any difference in sensation left to right? Is it more painful on the right?
I hadn't noticed that.
No, okay. Okay, so we've got one on the spine and then where the sciatic branches out to the right and another to the left. We've got one on the thoracics where there's a lot of tightness, hoping to help the neck. Might put another one here.
I don't much like that one on my spine lower down, don't worry.
This one?
Yeah. Perhaps it's just because I don't know.
Is that okay there?
Yeah.
They feeling all right?
Mm-hmm. That's nice.
Okay. So I'm going to work on the pelvis from the leg, just checking out the foot first for all the reflex points for neck, spine, pelvis, hip. Yeah. Okay, giving it a good free up. And then into the pelvis, rocking out. Beautiful, lovely. Oh, that's nice and loose. Great. That bodes well. Okay, and down. Okay, hip. Oh, that's tight. That's better. There you go. And then in, out, rocking, looking at the pelvis, checking for alignment. It's a bit tight there. And moving the pelvis using the legs and down. And then piriformis, which is often tight with lower back pain. That's good, really good. And oh, this is the tight one. Okay. Let go, let go, let go. That's it. Easy, easy. Okay. Remind me, I've got a nice piriformis stretch exercise for you to do at home that will also help get rid of this pain. So I've just got 2 hands on the sacrum, tuning into the QiGong energy, feeling what the spine is doing and the cerebral spinal fluid. It's such a lovely feeling. I feel very grateful that I can give this therapy and tune into that feeling of the fluid easing up, that pulse balancing out, so that the fluid isn't hindered or impinged by tense muscles or subluxated vertebrae, but it is free to move. And therefore the nerve connections are easing up and allowing nice, smooth movement, no pain.
I'm surprised you've got so many on there.
Yeah, you had 6. So you've got a few, as in your name, some nice rosy marks there, but nothing, I don't think any of them are going to last that long actually.
No,
They look okay. I bet you'd fancy some hot socks at the moment, wouldn't you?
Ooh, that's nice.
Straight from the radiator.
You know, I put my clothes on the radiator if I'm wearing, you know, whatever I'm wearing the next day, or the same as the day before, I put them on the radiator overnight.
Lovely.
On the towel rail.
Lovely.
It's so much nicer getting dressed.
Oh, it totally is. Yeah. Okay, let's have a look at you now. Good bounce. Okay. That's better. Arms are lying well. Just going to get my hands under your neck. Sorry, your neck's lovely and warm. And then have a feel of the top of the spine. Yeah, there's some tightness there.
Yeah.
Yeah, this is what needs to move. Oh, it's particularly tight going to the right. And then into the neck. Fingers to the top of the neck. So let it go, loose, loose. That's it, beautiful. And a nice stretch. Turning to feel the neck, bouncing my thumb on each cervical. And then the spinal arms that wrap around. Yeah, okay. Not too bad. Oh, there we are. Yeah, sorry, that's some tightness quite high up on the neck, so about C2. This is the one when we did that glute max test with your knee bent behind you. So this will help free that up. There we are. Ooh.
Oh.
Okay, let it go. Breathe, breathe. Beautiful. Nice abdominal breathing.
Ooh.
Is it too much?
I'll put up with it.
It's a horrible feeling. It makes you feel sick, doesn't it?
Yeah.
I have this done every month.
Do you?
And yeah, I know.
I should have it done every month.
You probably should. But
I know I did get into a bit of a routine of coming, didn't I? And then just, seem to always have to cancel, which is, annoying for you and just impossible for me to sort of do everything.
Yeah, yeah.
Perhaps I should try again. Oof.
That's it. Let go, let go, let go. Yeah, so I know the feeling. To me, it tastes a bit. Well, it feels a bit metallic. The kind of pain it is.
Yeah.
It's like a sort of grating nerve kind of feeling.
It's horrid pain.
Yeah, it's horrid. But I call it horrid, but in a nice kind of way, because yes, that's the place. It's going to get it right. And then nice and heavy into my hand, feeling into the muscle now, each side of the back of the neck, the sternocleidomastoid, and then tipping back, letting it tip, almost like you're looking at the back wall. Letting go, letting that muscle go. Yeah, that's it. Go nice and long. This is the bit long at the back. So that's when we're thinking about a good posture for our neck and head. It's like it's long at the back where the spine is. That's the bit that needs to be long and straight.
Okay.
And a nice level chin. And now the muscle at the front, sternocleidomastoid. That's not too bad. That feels good to me. That's great. Okay, that's a good sign. Oh, yeah, that's eased up. Oh, lovely. So one more of these, letting it go. Good. So this is called a neck release, a core therapy neck release, and it helps free up the neck at the key place, which is the bottom of the occiput and the very top of the spine, where there should be a gap, and there isn't in most people. And then lengthening out, creating some space, and then a good stretch from neck to shoulder tip. Good. And picking up the top of the trapezius, easing that where it can pull the neck. Good. Okay, so I'm just going to do my notes. So we've just got a few retests to do, but first of all, if you'd like to have a nice stretch and a deep breathe. So can you raise your left arm and your left leg together? I'm going to push, you're going to hold up nice and firm and hold. Hey, see how different that is? And it just was soft and bouncy earlier. So that is that sacroiliac separation that I described earlier. So let's have a look at the psoas. So don't need to do that side because it passed earlier. So I'm taking the leg out to me. I'm going to raise the leg up into the air. I'm going to try pushing down to the floor. You're going to hold up and hold. Absolutely so different. This is the one that was both sides really soft earlier. I'm going to push down. You're going to hold up and hold. Absolutely brilliant. So that's when I had my my fingers under your back and your neck earlier.
Okay.
Sorted. So your neck will feel a lot better.
Good.
And then can you bend a knee, putting your sole towards this knee, resting that leg out as much as it will, and then this leg up into the air. I'm going to push here and hold. A lot better. There's still a bit of softness there, which I would work on if you came back, but a lot better. So that's testing whether that hip is happy opening.
Right.
And then the same this side. This leg up into the air and hold. So that's a lot stronger. Hardly any squashiness to that. So this hip is a much happier opening now. Can you put two fingers on your pubis symphysis, hard bone, dead centre of the pelvis, raising this arm and hold? Absolutely brilliant. Okay, and then your ACIS. So this arm up into the air and hold. Good. And again, and hold. Brilliant. Good. So there's still a couple that are stronger, but still a little bit soft I would want to work on, should you come back.
Yeah.
Pelvis still needs a little bit of realigning, but it will feel a lot better. You may, for a couple of days, just feel the effect of the treatment that you might remember from before having core therapy. Just things feel in a different place. You just feel realigned.
Okay.
You should feel a lot better.
Okay.
Okay.
Okay, thank you.
My pleasure.
All right.